Greetings, everyone. It is remarkable to think that it is 1 year ago this week that we were issuing some of our first communications about the COVID-19 pandemic. The Foundation had made the decision to cancel all in-person events, and our cities and communities were just beginning to shut down. We knew so little in those early days about the new coronavirus and were unsettled by what it could mean for people with CF. Now, 1 year in, I want to take a moment to reflect on what we've learned about COVID-19 since then and why we are so optimistic about what lies ahead. For starters, this past December, we were pleased to see the promising study results in adults and children published in the Journal of Cystic Fibrosis, which reaffirmed that COVID-19 has not affected people with CF as severely as we originally feared it might. We continue to closely monitor the cases of COVID-19 infection among people with CF through the CF Foundation Patient Registry. As of March 8th, there have been 1,277 cases of COVID-19 infection, meaning about 4% of people with CF in the US have had COVID. This number is about half that seen in the general population. About 15% of people with CF getting COVID have required hospitalization, and sadly, there have been 11 deaths reported in the patient registry, over half of those being in people with lung transplantations. While even one diagnosis of COVID or one death is too many, these data point to people with CF faring better than the general population overall in terms of lower rates of infection and incidence of severe disease. These numbers also demonstrate the remarkable job the CF community has been doing to avoid COVID-19. I know that this has required immense sacrifice, and I have been continually inspired throughout the past 12 months at the determination of people with CF, their loved ones, as well as their care teams. Now, as we look forward, there is much to be hopeful for. The fact that we have not just one, but 3 authorized vaccines is remarkable. As you read about and discuss the different types of vaccines, I want you to remember this key fact. All 3 of these vaccines have been shown to reduce hospitalization and risk of death from COVID by more than 99%. We can also be encouraged by the medical and scientific community coming together in ways we've never seen before, ensuring the critically important clinical trials remain on track, and identifying new ways to enable continuous care for people with CF through telehealth. And finally, it's clear that the CF community has demonstrated a newfound level of support for one another that is a testament to your resilience and tenacity. One of our top priorities at the Foundation is continuing to advocate for priority access to COVID-19 vaccines for people with CF. We recognize that the rollout of vaccines has been frustrating and inconsistent. In some cases, the criteria for receiving a vaccine are continuously changing. But things are improving. So far, more than 92 million vaccine doses have been administered to people in the US. We also recently began tracking COVID vaccinations in people with CF through our patient registry. While it is still early in the process, we are encouraged by the marked increase in vaccinations that is being reported. We expect that pace will continue to increase, particularly as more vaccines are available. We continue to highlight the importance of prioritized access for people with CF as allocation frameworks are updated, and we are teaming up with care teams to call on state decision makers when we see evidence that they are not following national guidelines. Along with concern about vaccine access, we recognize that the strain of 1 year under pandemic safety precautions has taken an emotional toll as well. Providing the CF community with resources and support for mental health continues to be a focus. And in the coming weeks, we will be holding a dedicated event focused specifically on mental health and well-being. We look forward to sharing details on that event soon. So with that, and as I close this message, I want to remind you that there's a reason that the CF community is so often referred to as a family and referenced as one of the most amazing stories in medicine. I'm so proud of how far we've come and all that we've accomplished together in the last year. Thank you as always for your resilience, your support for one another, and your remarkable community spirit. I have complete confidence that we will get through this together and that the pandemic will soon be behind us. In the meantime, we will continue to be here for you until it's done.